Criteria of medicine selection. In order to select medicines to be included in the Emergencies and Disasters Essential Medicines List, or EDEML, the following were considered. First, the common health problems encountered in the regions post emergency and disasters. Second, the medicines with proven efficacy for clinical relevant outcomes and adequate profile of safety, which, according to the methodology of the WHO Model List of Essential Medicines, has the supporting evidence to be indicated for solving the above selected health problems. Third, pharmacokinetic characteristics of selected medicines with adequate benefits were considered in order to meet its suitability to the majority of the targeted population. Fourth, all medicines, nomenclature, and formulations in the EDEML are in accordance with the last version of the WHO Essential Medicines List. Fifth, cost of treatment was also taken into account to select the most cost-effective medicines. So here are the list of common emergency drugs: the atropine, sodium nitroprusside, amiodarone, aminophylline, mannitol, magnesium sulfate, epinephrine, hydrocortisone, heparin, diazepam, and dextrose 50%. So first drug is atropine. It indicates with the sinus bradycardia, bronchospasm, organophosphate poisoning, and cardiac arrest. So the dosage for sinus bradycardia is 0.5 to 1 milligrams, repeated every 3 to 5 minutes when necessary in adults. For bronchospasm, it is 0.025 milligrams per kilogram in 2.5 ml and as via nebulizer every 6 to 8 hours. For organophosphate poisoning, it is 2 milligrams IV every 3 minutes, according to clinical response in adult. For cardiac arrest, it is 1 milligram every 3 to 5 minutes. The mechanism of action of atropine is it competitively blocks the muscarinic receptors in peripheral tissues such as heart, intestines, bronchial muscles, iris, and secretory glands. And it also relaxes the smooth muscles. So the main action of vagus nerve of the parasympathetic system on the heart is to slow it down, and atropine blocks that action and speeds up the heart rate of the person. The atropine drug interactions include the effect of the drug increases with quinidine. It is an antiarrhythmic drug. Second, amitriptyline. It is antidepressant. Then diphenhydramine and meclizine, both are antihistamine. So the contraindications for atropine includes narrow angle glaucoma, pyloric stenosis, prostatic hypertrophy, thyrotoxicosis, cardiac failure, and tachycardia. For the adverse effects, it includes palpitation, dry mouth, blurred vision, urinary retention and constipation, tachycardia, dysphagia, dysrhythmias, hallucinations, and raise in intraocular pressure. The second drug is sodium nitroprusside or nitropres. The sodium nitroprusside is indicated for the immediate reduction of blood pressure of patients in hypertensive crisis. So concomitant longer-acting antihypertensive medication should be administered so that the duration of treatment with sodium nitroprusside can be minimized. The dosage should be 0.5 to 10 mcg per kilogram per minute through IV infusion. The mechanism of action is the principal pharmacologic action of sodium nitroprusside is relaxation of vascular smooth muscle and consequent dilatation of peripheral arteries and veins by producing nitric oxide, thus reducing preload and afterload. So the drug interactions include avanafil for life-threatening interaction, amlodipine, clofidipine, nifedipine, verapamil, and clonidine. So the contraindications include hypersensitivity to drugs, congenital optic atrophy, tobacco amblyopia, acute congestive heart failure with reduced peripheral vascular resistance. So the adverse effects include excessive hypotension, cyanide toxicity, thyroid suppression, and thiocyanate poisoning, metabolic acidosis, raised intracranial pressure, and bowel obstruction. So the third emergency drug is amiodarone. It is used for frequently recurring ventricular fibrillation and hemodynamically unstable ventricular tachycardia. So intravenous amiodarone can also be used to treat patients with life-threatening ventricular tachycardia and ventricular fibrillation. So the dosage should be 300 milligrams IV after epinephrine dose if no response to defibrillation in ventricular tachycardia or ventricular fibrillation, and 150 milligrams IV bolus in 10 minutes, may repeat as necessary in hemodynamically unstable. Amiodarone mechanism of action is it is generally considered a class 3 antiarrhythmic which inhibits adrenergic stimulation. It affects sodium, potassium, and calcium channels, markedly prolongs action potential and repolarization, and decreases AV conduction and sinus node function. So the amiodarone interactions include cimetidine. It inhibits CYP3A4 and can increase serum amiodarone levels. Warfarin, dofilitide, amitriptyline, propranolol, and digoxin. The contraindications include hypersensitivity to drug, second or third degree AV block, cardiogenic shock, severe sinus node dysfunction, and it is also advised for female to avoid breastfeeding when taking amiodarone. The adverse effects include hypotension, AV block, congestive heart failure, bradycardia, cardiogenic shock, and impaired memory. So the fourth drug is aminophylline. So the indication is acute exacerbations of the symptoms of reversible airflow obstruction associated with asthma and other chronic lung diseases. Example are emphysema and chronic bronchitis. So the dosage should be 5 to 7 milligrams per kilogram through IV or PO for over 20 minutes. The mechanism of action is smooth muscle relaxation, for example, bronchodilation, the suppression of the response of the airways to stimuli, such as non-bronchodilator prophylactic effect. The interactions include dipyridamole, riboxostat, riociguat, cimetidine, ciprofloxacin, and cigarette smoking. The contraindications include hypersensitivity to drugs, active peptic ulcer disease, underlying uncontrolled seizure disorder, and the adverse effect for aminophylline includes serum concentration less than 20 mcg per ml, diarrhea, nausea, vomiting, diuresis, exfoliative dermatitis, skeletal muscle tremors, tachycardia, flutter serum concentration greater than 30 mcg per ml, acute myocardial infarction, and seizures.